everyone, welcome back to our channel Mabi Health with your favorite nurse Mabel. So this is a part 2 of our sickle cell series. If you want to watch the part 1, the link is in the description below. You can follow, watch and ask any question you want to. So a quick recap of the part 1 series. We spoke about sickle cell, what sickle cell does to the individual, how sickle cell comes about, and some symptoms, signs and symptoms of sickle cell. We also spoke about things to avoid if you have sickle cell. So let's move to the part 2 of this series. So we mentioned in the past video that sickle cell crisis pain is sudden and it lasts from few hours to even days. Yes, and this pain is sometimes sharp, sometimes dull, sometimes piercing or throbbing. Yes, and we also mentioned that the pain is very excruciating, and those that go through the pain really go through an ordeal. And so if you begin to experience any of these mild symptoms, please speak to a health provider or visit the nearest health center to be attended to. Okay. Sickle cell in itself can damage a lot of body organs. We talk about the kidneys, the heart, the liver, the gallbladder, your eyes, the bones, and even the joints. Yes. And so you want to be very careful when you have sickle cell. Cold, extreme cold shouldn't be your friend. So those with sickle cell that love to stay in the AC, please, it's a caution. Advise yourself. Extreme heat is also not good for you. Though when you are having these joint pains, heat can be a friend, but don't subject yourself to extreme heat. It will trigger your symptoms. Yes. So today we want to delve into diets as a sickle cell patient, as a person living with sickle cell disease. What should be your diet? What should you eat? What should you avoid? Yes, let's talk about diet. Your diet should be any diet that increase and balance your nutrition. Yes. You do not have to necessarily follow every diet plan that I'm going to talk about if you don't like it. There are some people that react to certain fruits, to certain vegetables, basically certain foods. So if you are one of those, don't force yourself to follow what I am going to share with you today. There are things that you like and things that you do not like. Yes, so these things that you do not like, some will help as a sickle cell patient, but it doesn't mean that because you don't like it and it's still going to help, you should go for it. No, if you don't like, you don't like. There are others, you have other alternatives. There are so many alternatives that you can go in for. Yes, so let's talk about your diets. You have whole grain bread, you have rice, you have pasta and cereals. Yes, so these are high in folate, vitamin B and magnesium. Yeah. With your diet, you simply need to find any diet that will increase and balance your nutrients. That's all. That's all. Any diet that you think you are comfortable with. Any diet that when you follow, you won't react to. Yes. And you are sure that is going to increase and balance your nutrition, just go in for it. So we talk about zinc here. Foods that are rich in zinc that as a sickle cell patient you can go in for. You have nuts, fish, you have meat, beans, dairy products and whole grains. All these are sources of zinc and it's good for you as a sickle cell patient. We talk about folate. You have green leafy vegetables like broccoli, you have spinach, you have asparagus, you have certain fruits like papaya, strawberries, you have peanuts, you have foods that is fortified with folates like cereals, like rice, beans, like bread, pasta, cornmeal. You also have to take in a lot of water and liquids. You know dehydration is not good for you as a sickle cell patient. As soon as you go into a dehydration mood, the symptoms will start flaring up. Yes, so you need to take in a lot of water. It will be best if you can take in like 8 to 10 glasses of water a day. It's good for your health. And do a lot of liquids as well, like fresh fruit juice. Please, caffeinated drinks shouldn't be your friend. It's also going to cause dehydration. Though it's a drink and you think that you are taking in more fluid, the caffeine in it is not good for you. Yes, so please don't do caffeinated drinks, but I'll advise fresh fruit juice, a lot of water, and anything that would prevent you from being dehydrated. Yeah, going for that. We have milk, yogurt, and cheese as well. When it comes to the foods that you are supposed to, I'll mention a few. It doesn't necessarily mean that you should eat or even if you react to any of them. You know, there are people that have these bumps, rashes, and itchiness all over their body when they eat pineapple, especially. If you are one of those, avoid it. If you aren't, you can go ahead and eat it. Some fruits like watermelon, you know, there's a lot of water in there, so it will keep you hydrated. Yes, so some fruits like avocado, pear, blueberries, apricots, banana, prunes, apples, dates, cucumber, raisins, melon, that's honey melon, or yellow melon, or watermelon. Any of those, you can go in for it. Yes. With vegetables too, you have asparagus, you have beetroot, broccoli, Brussels sprouts, cabbage, carrots, green beans, cauliflower, celery, turnips, spinach, bell peppers, eggplants, mushrooms, peas, potatoes, radish, and beans. With whole grains, you have oats, rice, brown rice, cereal, and all that. And healthy protein. With healthy protein, you can do eggs, nuts, fish, lean meats, and poultry. Yes. And with a dairy product too, I'll advise you go in for a low-fat milk. Yeah, low-fat milk, yogurt, soy milk, and a cottage cheese. Yes. Let's talk about phosphorus. Yes, with foods that are rich in phosphorus, sources of phosphorus, you have almonds. We mentioned milk, yogurt, cheese, beef, egg, chicken, turkey, and fish. With fiber too, you can go in for your oranges. Yes, your cauliflower, broccoli, raspberry, seeds, green beans, and eggplants. With calcium too, you still get calcium in spinach, mustard greens, collard green, turnips, oranges, salmon, and fish bone. You can also do cod liver oils. Yes, you have some calcium in there. With vitamin C, you have kiwi, you have orange, vitamin E, mustard greens, sunflower seeds. With folic acid, you have spinach, asparagus, black beans, papaya, and garbanzo beans. Yes, folic acid plays an important role in the development of the red blood cells. Yeah, so a lot of patients are put on folic acid. It should be an everyday thing for you. Every day you take one. Please, if you are put on folic acid, please take it. Yes, because it's going to help you. With vitamin D2, the best is exposure to sunlight. Vitamin A, you have carrots, yams, sweet potatoes, spinach, and kale. Vitamin A. Vitamin B12, you have spanner baked, steamed shrimp, baked salmon, cow's liver, and supplements. Yeah. We do supplements for the vegetarians, those that won't be able to get it from meat, fish, egg, chicken, and all that. We recommend supplements for them. So there are a few tips that I want us to take note of. That's number 1, extreme cold. 2, extreme heat. Please avoid these things. Emphasis on extreme. Yes, you know, too much of everything is bad anyway, so avoid these things. And to my men, those that experience priapism when the weather is cold, especially in the AC or during the raining seasons, there are certain instances where you can't get to the hospital immediately. You can do a little exercise, which sometimes help. But if you start the exercise and you realize that it's not working, please don't make it strenuous. Just find a way to the hospital. Yes, and you will be sorted. And please, if you notice these symptoms, talk to your doctor. Before that, there was one lady that I schooled with during our days in NTC. This girl never felt sick even for once, and she didn't do any blood works too, so she wasn't aware of a genotype until we went to clinicals one day, and I became friends with the lab technicians. So I went there that you should run a blood test, although I've done it and I knew, I just wanted to do it again. She followed me there and she also decided to do some, and lo and behold, it came out and she was SS. And she didn't believe it. She said it was a wrong analysis that the lab technician did for her. So she didn't believe. She went outside to go and run it with another lab, and it came out as SS. She was shocked, simply because throughout her life, she was over 20 years and she hadn't experienced any of the symptoms. As that is not because she doesn't have, or she's lucky, or those things. No, there's nothing like that. It simply means that even though she didn't know her status, she was taking very good care of herself. So it means that when you take very good care of yourself, you also not experience any of these sickle cell crisis. Or symptoms do not flare up. You not have anything to do with sickle cell. So please take very good care of yourself. Yes, just as my friend did. And if you notice any of these things, let's say you are scared, you've not mastered the courage yet to go and run a blood check on yourself to know your status. If you notice any of these symptoms, speak to a doctor. You notice that your appetite has changed, your activity tolerance has changed, the color of your urine has changed, has become more darkened, like Coca-Cola, or any like darkened color, like your urine color is not normal. I mean, the normal is an amber. If it is not amber, is anything different from amber, you speak to your doctor. When you're experiencing excruciating pain, especially in your joint area, speak to your doctor. You realize that you're having fever. I mean, fever is a sign and a symptom of a lot of conditions, but you realize that yours is becoming persistent, especially when the weather changes. Please speak to your doctor. When you realize that your hands are swelling, your feet are swelling, please speak to your doctor. Even when you think that there's nothing wrong, maybe you're tired, that's the reason why you're having all those swelling. When it becomes persistent, it means that there's a problem. Speak to your doctor. One of a very common sign of sickle cell is an excruciating pain in the abdomen. If you experience that, speak to your doctor. Sickle cell is real. Like, I'm very passionate about this topic. Sickle cell is very real. Please do your blood checks. Like, I'm saying this over and over and over again because it's very important. Before you love, before you fall too deeply in love with your partner, please do your blood checks. You are going to break somebody's heart. It's better than subjecting your child to a lifelong suffering. Yes. So we've come to the point where I enjoy the most, which is the tips that I give away. So today's tip is how to manage your sickle cell crisis at home. I mean your pain. So one, you drink a lot of water and fluid, a lot of it. When your symptoms begins to flare up, you have to be hydrated. Remember that dehydration is going to subject you to a lot of pain. So drink a lot of water. Say 8 to 10 glasses. That's fine. Yes. And when you begin to feel pain in your ankles, your joints, your elbows, your knuckles, begin to feel pains at this site, that it's a sickle cell symptom. Yeah. So you need to apply ice. That being said, for a sickle cell patient, it is best for you to get hot water bottle. Yes. It's on your screen. If you don't know what hot water bottle is, it's on your screen. If you can't get this hot water bottle, you can improvise. Yes. Pour some hot water in a bottle and then you pad it with a cloth so that you don't sustain any burns from the heat. Yeah. And then you apply it to your joints. You apply the hot water to your joints so that the pain, it will lessen the pain. The swelling will also cool down. Yes. Please don't contradict this with extreme heat. This is just a measure to relieve you of your symptoms of pain, especially the pain in your joints. It is not extreme heat. Extreme heat is staying long in the sauna, this heat inhalation, like you stay long under the blanket and you're inhaling the steam, it's going to trigger the symptoms. That is extreme. But applying hot water bottle to your joints is not extreme. Yeah. Take a massage. It also helps. Acupuncture. Let somebody massage you. A very good one. Not the one that they'll be pressing your joints and your bones, and by the time you realize you are more sick than him. It's a very good massage. Visit a spa. You get that one. And then finally, do something to take your mind off the pain. You can do video games. You can call friends, play and pay Ludo, something. If somebody is around and the person is engaging you, definitely your mind will be taken off the pain. Of course, this is when the pain is not so severe. But when it becomes severe, please don't stay at home. Visit the nearest hospital and you'll be taken care of. So all too soon, we've come to the end of our series on sickle cell. If you have any question, sickle cell is broad. There's a lot of things to learn about sickle cell. If you have any question, don't forget to drop it in the comment section. And please again, subscribe to my YouTube channel, hit the notification bell. Please like my videos, share, watch to the end, please. And to our old subscribers, we will not stop thanking you. We are so thankful. Thank you and God bless you. We'll see you again in our next episode. Bye.